Diabetes is a dietary disease, okay? Almost for sure it's a dietary disease. We know that. Yet, if it's a dietary disease, the cure is going to have to be dietary. You can't take a dietary disease and treat it with drugs and pretend that that's going to make things better. But yet that's what we've done. We've taken a disease which is dietary in nature and we've prescribed you drugs that suppress the symptoms. It's not going to make it better, and it hasn't. The last 30 years has borne it out. The third thing is that this is not a chronic progressive disease at all. This is in fact a curable disease, but you have to treat it the right way. You have to understand what you're doing. So one of the things we do in our clinic is that we are looking at ways of how to lower the insulin levels. And that's the real thing. And one of the simpler ways to do it is intermittent fasting. And that's why we have a lot of people on these sort of protocols. And one of the things to remember is that fasting has been done for many, many years. You know, everybody thinks that it's so crazy. Everybody hears about it at first and thinks it's crazy. But you have to remember that fasting has been done for thousands and thousands and thousands of years. And not only that, but almost every single major religion in the world has periods of fasting that are prescribed. Not because, you know, of any particular reason, but they recognize that it is actually a very healthy thing for people to be doing every so often. And why is it so healthy? Because what happens is that when you fast, your insulin levels go down very low. Because you're not eating, your insulin levels go down. And having periods where your insulin level is down helps prevent that vicious cycle, right? It's the insulin that leads to the resistance, which leads to higher insulin. It's a vicious cycle. So if every once in a while, you know, you do Ramadan, which is a month of fasting, or you do, you know, the 40 days of Lent, or whatever it is you do, if you have a period now where your insulin level is very low, you're going to completely break that vicious cycle. And if you do that routinely through the year, then you will stay healthy. You will prevent the development of that resistance. If you don't get the resistance, you don't get the high levels. The first case we have is Richard, who's here today. And so he's had diabetes for about 10 years now, and he's had a few complications, including some kidney disease, which is why he was here in this office. And he saw a colleague of mine, Dr. Ting, and so he was referred into the intensive dietary management program. And we started him in June of 2013. And we started him with a fasting regimen as opposed to the amount of insulin that he had. So this is Richard and his wife. Oh, I can't see that very well. And this is what's happened to his weight. So his weight, starting just above 250, has been steadily coming down. And it's down to 210. His waist size has continued to come down. And his hemoglobin A1C, which is the measure of his sugars, has stayed relatively stable, below 7%. And this is him now. So if you look at what has happened to his insulin dose, so he started off with 55 units of insulin. And within, you know, 6 weeks, he was off of all his insulin. In other words, his sugars are doing fine, and he's off of all his medications. Completely. And his levels of A1C are no longer at a level where you could make this case that he is diabetic. In other words, you could say that his diabetes has been cured. By using these kind of simple understanding of diabetes, you can see that this is actually the rational, but also the natural way to cure diabetes. We're not talking about piling on more drugs for you. I mean, you go to some of these places, they'll tell you to take these experimental drugs and they want you to sign you up for drug trials. No. What we're doing has been done for thousands of years and is in fact exactly the way they used to treat diabetes. But they understood that it was a dietary disease. It has to be treated with dietary measures. This is the second case, Balraj, who's here this morning as well. So he was diagnosed in 2003 with diabetes, and he also had some complications of that. And so, you know, after treating him incorrectly for many years, I started him on the intensive dietary management program because, you know, back then I didn't understand much of this myself. Much of this is new. So he started in August, and so his weight has come down a bit. But you know, he started at 186 and he's come down, you know, 8-10 pounds or so. His waist has come down, but you can see his sugars, his hemoglobin A1C has stayed very good. And this is his medications. So again, starting at over 40 units, about 40 units a day of insulin. So this is what he had to take. Within 5-7 weeks, he was down to 0. He is no longer taking insulin. He's no longer taking any medications for his diabetes. Which again, you could say, if your sugars are good and you're no longer on any medications, you could say that your diabetes has been cured.